It's all in your head. You don't look sick. Your tests are normal. It's probably anxiety. There's nothing wrong with you. Have you heard these words from physicians, family, and friends? If you're someone who has been struggling and swirling through the revolving door of healthcare to find answers about your health, or if you know someone who is going through this experience, then this podcast is for you. Welcome to the Desperate for a Diagnosis podcast with Laura Nozica, a show dedicated to exploring the challenges of living with undiagnosed or rare medical conditions. This podcast explores both sides of the bedside. We will be speaking with patients who have had challenges with finding a diagnosis, along with experts in the field. I'm your host, Laura Nozica. Please note I am not a medical professional, nor am I affiliated with any healthcare, pharmaceutical, or device company. I am an entrepreneur, and I am an independent market researcher focused on helping healthcare organizations better understand the patient perspective. The podcast is not meant to offer medical advice, but to merely share the stories and perspectives of podcast guests. Hello, and welcome to the Desperate for a Diagnosis podcast. I'm your host, Laura Nozica, and I am so thrilled to be with this lovely lady. She is a colleague of mine in the insights industry. She's an insights consultant. As many of you know, I am a market research moderator in the healthcare space. And so I think through LinkedIn is where we met each other and started talking about podcasts. But Severine Tarayre is our guest today, and she will grace you with her lovely French accent also. It puts my all but like 8 years of French to shame between high school and college. But she's going to be with us today and talk with us about her journey with triple negative breast cancer, which many people know that there aren't a lot of targeted therapies for that. So Severine is going to tell us about her journey and how her breast cancer was diagnosed and her diagnostic journey and where she is now. But Severine, welcome to the podcast. Thank you so much for being here.
Thank you. I'm very happy to be here and share my story with your listener.
I'm so glad. I'm so glad because I think it was just through a post on LinkedIn. I think it was, and
Yeah.
it's how we met. Was that right?
Yeah, I think it was for the launch of your podcast and through a common connection. I commented on it and we started the conversation.
Yeah. And I think you said that even through your journey with cancer, that you had thought maybe one day you would like to have a podcast as well. So I thought, why not invite you on to be the guest in this point in time? But I'd love to see you as the host of your own show.
Maybe one.
Yeah. What do you think you would name it?
Oh, I will have to think about it and do some market research.
Market research. That's right. All good ideas start with research, doesn't it? Well, Severine, again, thank you so much. But tell our listeners a little bit about your journey, again, triple negative breast cancer, what that means in terms of the other kinds of breast cancers that women might be diagnosed with, and how this is so different from that standpoint.
Yeah, so most of the breast cancer are hormonal, so they are related to the hormone and dependent of it. And there are a lot of targeted treatments existing for this. But there are I think 10 to 15% of breast cancer that are triple negative. That means your, I won't be good at giving you the exact definition, but you have you don't respond to targeted therapy. It's not possible to specifically target your cancer. And the main difference is that it's very aggressive, so it develops very fast, and it's mostly touch people young people, so young women, and also African American communities. And the way also the big difference in terms of treatment is that there is no really ways to prevent recurrence. like most of the women that you may know that have the breast cancer will have like a drug like called tamoxifen for like
Hmm.
5 to 10 years after the end of a treatment that will reduce the chances of recurrences. That doesn't exist, or at least at my time, there are like a lot of progress since then, but there was nothing to prevent recurrence. The recurrences are much more important, particularly for the first 3 years after treatment for triple negative breast cancer.
Wow. And how long ago were you diagnosed?
So I was diagnosed almost 9 years ago. It was in May 2015.
Yeah. And as you said, this type of breast cancer is usually uh, affecting young women. And so you are a young woman for sure. So, how long did it take, Severine, to get this diagnosis? What was that journey like for you?
Yeah. So I was, as you were saying, like I was very young and still young. Like I was
You are.
36 at the time, and really doing all my checkup regularly. I've been to that year, like 2014. I've been to my OBGYN in December, and 6 months later, not even 6 months later, like in May, um, I felt like a mass like in my breast. And it was easy for me like to figure out because I had like almost no breast. Like I was there, had a very tiny breast, and I was running a lot because I was training for a half marathon.
Oh,
So
wow.
it was, yeah, it was the spring. And so often like with like athletic wear, like I could feel really like the lump in my breast. Um, so I took an appointment for, I think, the day after or 2 days after my race. It was my first half marathon, and went to my OBGYN, and like she felt like the lump. It was very easy, like to fill in. She was where I could feel in her, like the way like she was reacting to this because she has seen me not even 6 months before, and there was nothing. So she sent me right away for ultrasound, and this is how like everything like kind of like speed up. And so I was sent to ultrasound. They found something. They saw there was something, but at my age, we said, yeah, it's could be something else. There is no reason. You are young. You are healthy, but let's do a biopsy. So we did the biopsy, and I think it took probably a week. I would say like a week or 10 days, like to get back. And I remember because I was supposed to get the results on a Friday.
Mm.
No news. And obviously I was nervous and stressed. So I called my doctor and my OBGYN, and I told her like, do you have results? And she was suddenly awkward. Like she was, oh, sweetie, I didn't want to call you today. I wanted you to have a good weekend. So I understood right away that was not positive. If she was just waiting for giving me the news, I was at the office at that time, and obviously, like I was kind of like sensitive. I had like the feeling something was wrong, but there's always like hope that it's nothing and
Of
maybe it's fine.
course. Yeah, of course.
So yeah, so it was a surprise. Um, so we went to see my OBGYN that day exactly, and she gave me the news on the second. So that was the first news: you have breast cancer, and the second bad news was you have triple negative breast cancer. So and you could, and I saw it like many times during my journey that when you pronounce the word like triple negative breast cancer with the healthcare providers, like there is a different reaction because they know like the outcomes have not always like been good. Like there are a lot of progress, but at least like we are talking like 9 years ago when they were seeing like someone like in their mid 30s with diagnostic, like it was like some fear, like and worries about this.
Oh my gosh. So, and how scary too, because being 36, certainly not at that point yet where you would have had a baseline mammogram, of course, unless of course there was maybe a history in your family. Had anyone else had breast cancer?
No,
When?
so that was why I would say like the the hospital where I was treated, like Sloan Kettering, loved my case, kind of, is that I was healthy, I was athletic, I had no family history, I was young, so I was kind of a case that they wanted to explore to understand. So that's why I was lucky in my stories that I got all the best, like the best surgeon, the best plastic surgeon, the best oncologist, because everyone was curious, like to understand what was going on and what they can learn from my case.
Hmm. Yeah, because there's no indication, because we always think if there's some type of either history or genetic marker. Had you had any genetic testing?
Yeah, so that was one of the first thing like they had to do. Like so between like that first like diagnosis, like so my OBGYN told me, okay, like you have triple negative breast cancer. Now you need to find a hospital to treat you. So that's the first like race. Like I've never been like sick. Nobody in my family, like in New York, have been sick. So she like it's all the insurance word that you have to navigate into. So our first recommendation was their call MSK, Memorial Sloan Kettering, see if they can take you. Otherwise, she gave me a different option. And then from there, it's not her, she cannot handle this. It's really like the medical team there. And between that first diagnostic, that was purely it. It was 29th of May. And the beginning of the treatment was about, like, I would say a month.
Mm.
And it been pushed back a lot because we wanted to understand, to have like the full kind of image of where, like the full landscape, like understand, like, is there something else? Like, could they figure, can they know, like, if it already spread? So it's also like it had like other like issues at the same time. So we discovered that the thyroid issue that we still don't know if it was related to it or not, but we needed to do additional exams. So every time it was planned for chemotherapy, to start the chemotherapy, we were, oh no, sorry, like we have to push it back. You need to come back for a PET scan, for
Mhm.
additional test, until we really have a full picture and can understand like what's the best treatment for you.
Wow. So you said you had had a thyroid issue with.
Yeah, I was the hyperthyroid
Okay.
issue, but we didn't have also benchmark. Like we didn't have anything to compare because I've always been very healthy. I was maybe not good at doing like my annual checkup, and that's was maybe like also like an issue because we had no other like blood test to compare to. So maybe I always had that
Mm.
thyroid issue. Maybe it happened with the cancer. And so it was a lot of question that I didn't have answer and not much to give to them. Like, so we were starting from a white sheet and trying like to get like as much knowledge as my body, my history.
Yeah, it's interesting that even in mid-30s, there are certain tests that we should probably be having, but because there's the assumption that because you look healthy, you feel good, that there's nothing more going on inside, and we
Yeah.
don't always know. So, like you said, maybe your thyroid was always high, hyperthyroid, but you wouldn't have known because you hadn't had a baseline yet at that
Yeah.
point. Mhm.
Yeah, exactly.
Yeah. And so knowing that you were being tested for what was very clear it was a mass, but certainly not knowing whether or not it was benign or malignant. But what's going through your mind through all of the testing? And of course, lots of anxiety. Like you said, you were waiting for the results, but what was going through your mind through all of that?
So first, like it's a lot of fear, pretty because I didn't know about triple negative breast cancer. I knew a little bit of about like breast cancer because I think we all have someone who has breast cancer. Out of 8 women will have breast cancer in their life. So yes, I knew people went through like usually like very good outcome, but triple negative was completely a new thing for me. I've never heard of it. So you do the thing that you're not supposed to do, and you Google it, which is not a good thing to do, but I think everyone would do that. There was not also at that time, and it has changed a lot because I've seen through a lot of like support group purely for young women from triple negative. Now, like they are like great like support group, but at that time they were not. So you're kind of on your own.
Mm.
So a lot of fear at the beginning, and I think for me, the worst was really like between the diagnosis and starting like my protocol when you don't know how we'll fight it. Because once you know like what will it do, that's fine. But before like you the pushback, they say, oh, maybe we'll do chemo first, or maybe you won't need surgery depending on what we think we find after chemo. Maybe you will have another treatment depending if the genetic testing comes back positive. And I skip, I think, your question about the genetic testing. Yes, I was tested. It's pretty long to get results.
Yes.
So we started treatment before knowing the results, but it was important to get the results to decide about the surgery. And I don't have BRCA1 or BRCA2, like the main like genes that are associated with breast cancer, but I have what I call, again, not in medical term, but a small gene
Mm.
that's called BOD1. So they know there is a relationship with breast cancer. There it's not, or at least at that time, and even now, like there are not many research about it. So we just know the connection of breast cancer with BOD1 gene. They don't know yet. They don't think there is hopefully a relation with ovarian cancer.
Mm.
The BRCA1, BRCA2 have a strong relation with that. So that was also the main reason to do the genetics, is to understand if it's beyond like surgery for breast. It will define like if we do mastectomy, single, double, if we'll do ovarian treatment or surgery. So that was a key information for my treatment.
Right. So negative for BRCA1 or BRCA2, but BARD1, are you saying that genetic marker is solely for breast cancer? It wouldn't indicate a potential
Yes.
spread to ovaries, etc.
Yeah, but for now, at least in what we know from the research, there is no correlation, like a relation with the ovarian cancer. I don't have like higher chances to get ovarian cancer with this gene that I have.
So how did the doctors explain to you what triple negative meant? And how did you discuss what your protocol would look like? I think you said there were a lot of kind of the algorithm or the flow chart,
Mm.
if this, then that, depending on how you responded to therapy, to treatment. But how did they walk you through it? How did they explain it to you?
That's a good question. So since we decided, and it's kind of like the standard like approach, like the protocol for triple negative breast cancer, to start with chemotherapy, because the goal is to reduce like the size of the tumor, so maybe we can save the breast, or like save some part on. And it has to be it all the triple negative breast cancer, I think, always start with chemotherapy because it's aggressive and we need to slow down the progress of it. So that part was kind of a no decision, like it what you start with. So I spent a lot of time mostly with my oncologist, because she was the one who will manage this three month of chemo. She was very good at explaining. and, she was, I think, described by the healthcare team as a conservative. Like she will be very heavy on tests and being 100% sure of the treatment of everything. So the nurse knew that if I was with that doctor, like that oncologist, like I had like extra, like kind of tests extra, but it kind of reassured me like that she was really going in depth and trying to understand. Also, something from my background, like being like in research myself, like I understood all these statistics, all the protocol, clinical research, even if it's very specific and more scientific than what we do. I know how it works. Like I know the size of a sample, how representative statistically it is. So I can talk that language with my oncologist. She knew that I was using like there was an app where I receive all my blood tests immediately after they're done, like in the 30 minutes. So as a good researcher, I was doing my analysis like in the next minute. So every time she was seeing me, she said, "Okay, you saw your levels." Yes, I saw it. So my
Yeah.
questions.
Yeah, it's
So
kind of
yeah.
nerve-wracking though, because I think now all of those tests, regardless of what kind of tests they are pushed out as soon
Mhm.
as they're available, even before the physician gets to read them. So who knows if you're the first one to see your diagnosis, and sometimes we don't always have context for those tests, and then our minds are going in a million places, and then we are going to Dr. Google trying to figure out what it is or what it isn't. I know I've done it myself, thinking, "Oh my gosh, this is terrible." And the doctor comes back and says, "No, this is nothing. This is fine. You don't have anything to worry about." And I just got myself all whipped up, and it might have taken them a day to even get to the
Yeah.
test. So yeah, to get those tests back, especially in your situation, Severine, had to really be really nerve-wracking and scary for you.
Mhm. Yeah, it's both nerve wracking and also I think helpful to have that knowledge. Like I knew I've done like also a bit of pharma research. Like I don't know if it's completely random, but 6 months before I was diagnosed, I did some a great research project with nutrition doctors and healthcare provider and cancer patients about nutrition and exercise. And it
And
was random that I was in this situation like 6 months later.
I don't think that was random. I think that
Yeah.
was probably meant to happen for a reason. I don't know about you, but I'm certainly all about the signs, and things happen for a reason, and it's not just a coincidence. So there's a reason that you
Yeah.
got that project. Yeah.
Yeah, probably.
I believe that. Um, so you, so Severine, if I could ask, you have family, correct? Yep. And how did you talk with your family about your diagnosis, and what kind of questions did they have for you?
Yeah, so of the two kids, and at that time, my youngest was 5. Yeah, he was going to kindergarten in the fall, and my oldest one was 10. Um, so I can't remember exactly how we approached it, but for the little one, he didn't really understand. So it was kind of, yeah, mommy has some, like, is sick or is doing like some, has to go to the doctor, like pretty high level conversation, not into details. For my 10-year-old, like he understood, I think, by himself before even we explained too much. Like, yeah, one day he came back and asked, like, "Mom, what you have, is it cancer?"
Hmm.
So we had to have like the big conversation. I think they were stressed, but not so stressed in the sense that I've always, I never stopped working. So I was going
Oh.
to the office, everything was as usual. I was still trying to exercise a little bit. They never saw me sick too much until the end of the chemo. Like towards the end of the chemo, like I was really weak, and also like I lost my hair.
Oh.
It was the summer, so I was not really wearing like wigs, or when I had like hat outside, but when I was home, I was not wearing anything. So I think at that moment, like the were a bit like more worried. Already my 10-year-old, like that wanted to be a bit more protective and check on me. The little one, I don't think at that time, at least, like he did realize um how hard or how bad it was. But much we've always been very open, so we knew when I was going to the hospital, when I was going to the doctor office. So we never hide like really anything.
Why do you think that's important with children, to explain a parent's condition very openly and honestly?
I think it's important to have the conversation to understand like what are their fears so we can talk about it. We can explain. I think something that was helpful in our case is that a very good friend of us, like she used to be our neighbor. They moved to the UK. She went through recurrence of breast cancer 6 months before I got diagnosed. So they knew her. They knew she was well. Everything was kind of back to normal. So I think it was helpful for them to have some example in their life that it's not like a death sentence and there are like treatments and we can live with it. So yeah, I think it's important to have a conversation so they don't keep to themselves. And they feel free to ask questions.
And how about your husband? What was it like having to have conversations with him?
Yeah, so he was with me like for when we got the diagnosis or when we went to the first visit. Um, I think I cannot talk for him, but I know he was very stressed and try to support me as much as possible. So it was also a lot for him to handle because there are like things I could not do with the kids, or we had also like to change our organization at the last minute because when the hospital calls you and tell you, okay, this is now you need to get this test, like we have a machine for in the next hour, you need to be here as soon as possible. So you have to kind of leave at the last minute. I know for it was my son's kindergarten kindergarten first day of school, and that was a day of treatment. So
Oh,
I could not stay like for the full day with them. So it's more like also work and stress to manage for him.
yeah. So your husband had to jump in and kind of you all just kind of had to roll with it, right?
Yeah.
When you had to leave, you had to leave. Um, well, he sounds like a keeper,
Yes, sir.
Severine, and I understand that he's a pretty talented guy. Looking at the artwork behind you, is that right? Did you say
Yes.
those are his
Yes.
paintings?
Yeah, he does a lot of like painting now. He's into sculpture. So I think it's his way to kind of also like distress and relax.
Mm-hmm. Yeah. Well, he is very, very talented artist, and yeah, definitely that creative side can help with a lot of things, stress in particular. But what was the? So I want to talk about what the treatment was like for you. But what was it like for your husband from the standpoint of how he coped with your diagnosis and your treatment as well? Did he look for support or support groups in any way? What was that like for him?
um, yeah, that's a good question. Like he never like really looked for like groups or and is I think we have like different like type of like um yeah, we're different types, more like introvert and doesn't need like so much like to have like friends around and share. Will be a bit the reverse, but and also it's difficult. You don't want to share too much with the family because you don't want to stress them out because they were living in France. So it took a lot like on him. Um, and yeah, and he used arts like to relax. So that's a way like he will deal with stress. Yeah. And we had we were lucky to have a very good like support system here with friends. And also my work. I was in a woman-owned company at that time. I've been with them for a long time at that time. So I got my second child. I was in that company. And so they knew me very well and they were very supportive. Like things that they've done, for example, they were sending us like a meal, like a delivery, like of food, like each time I was going to chemo. So the night of chemo, like there was nothing to prepare. We had food. It was also all entertaining for the kids because it was like something new. They could pick. So they were very supportive. I always had like a friend going with me for chemo, and some session it was with my husband, but otherwise I'd always like someone who will come with me to the chemo session.
Yeah. So how would you advise a woman to work with an employer when it comes to treatment, cancer
Mm.
treatment?
Um, so my experience was, I think, very particular. So when I got that my diagnosis, I was at work. So they were aware from day one, even before, because actually the day I had to do my ultrasound on the biopsy, I think I was supposed to be on a call with a client and I had to cancel at the last minute. So I mentioned it to my boss, like the CEO of the company, that I'd like to make some changes of plans. I didn't elaborate, but I told her like I had to do like medical exam. So she knew from day one. And we were very close. And yeah, when you don't have your family around, like it's kind of like a different relationship with her. So I think she knew before my mom knew. So she knew from day one. A few other people also knew. So they were very supportive in my case. And I was very transparent. Like I told my colleagues through an email because I didn't want to be there. So I think
Oh,
it was before remote was a thing, but I think that day I worked remote just because I didn't want like to have all the emotions in person that day. So I told them like from the beginning, and so my company knew, but not everyone knew in my friends. So I kept it uh, pretty like close, like so only my close friends, because you don't want also like to change like the way people look at you or
mm,
like pity. So I
mm,
kind of selected at that time who I wanted to be aware. So it was more really my supportive system, like my support system, very close to me.
mm. Was it did you feel that it was more important for you to communicate your diagnosis through you said through email, right? Because you said you don't want to get kind of into the emotions. Were you thinking more about your colleagues or more yourself? What were you thinking from that standpoint?
Yeah, I'm pretty emotional, so I didn't want like to like have like so much emotion at the same time. I seem like I knew everyone very well for a long time. So and they were amazing after, but it was too much for me to be there and seeing people coming to me. So that's why I did it that way.
Yeah, it would be overwhelming, wouldn't it?
Mhm. Yeah.
Yeah. So if we go back to your treatment, you said the first step in the protocol was chemotherapy. So
Yes.
what was that like for you and what kind of chemotherapy was it? Was it a combination, a cocktail, or was it
Yeah.
monotherapy? What was that like?
Yeah. It was a cocktail and I forgot all the name, but it was at like a chemotherapy session every 2 weeks. So I started with I think if I'm right, at 4 sessions of a cocktail with among like the cancer patient, they know it's like kind of a red, like big, like a syringe, like it's it's a red treatment that's very specific. I think you even see it like in your veins when it goes through.
Oh, oh
And
wow.
other one. I will give you like the name, but I didn't revise the name of it.
That's
So
okay.
yeah, the first 4 session was a combination of two, and the last four was Taxol. And I was this before last was very like it was like hard. It was really hard on me because also your body like starts to be weak, and I think I had like more side effects on Taxol.
Mm.
But yeah, after each session is kind of a discovery of what will be the side effects. Is the surprise. Surprise after each one will be the nails. I had like some neuropathy. So for the Taxol, I had to put my hands and feet in ice
Mhm.
during the treatments. So
I've heard that. I've heard even women will put their feet in like bags of peas or
yeah, that's what we
something
were
like
doing.
that. Yeah. And what is that supposed to do, Severine?
Because otherwise you have so the first session of Taxol, we did like I could feel like some neuropathy. So it's like something is tickling like in your hands and feet. So it to help like not to have this effect. And also it can last, so it can be an issue. They give you like bags of ice and we cut like during a session, which is very long. The Taxol is very slow because we have to do it like very slowly because of risk of allergies. So I think a session is at least 2 hours and a half. Why the first fourth treatment I had, like the first fourth session of chemotherapy was more like an hour or something, but the Taxol has to be like infused longer in a longer time because of the risk of allergies. And they give you like these bags of ice for your feet, hands, so to avoid neuropathy. And you're also a bit drugged because of the risk of allergy. You have a lot of allergy like medication in addition to.
Wow. So you're having chemotherapy and cryotherapy all at the same time on your
Exactly.
hands and feet to prevent the neuropathy. Yeah, like a nice massage would have been better, I'm sure, right? Not this cold therapy, but they say it's very good for inflammation and also, but did you feel that it helped, the ice?
Yeah, after I didn't have like a neuropathy again
Mm.
or after, so I feel
Oh, that's
yeah.
good. That's great. So your chemo was how many months then?
So it was about 3 months. So we started end of June. It was down like end of September. Yeah.
Okay. And what were some of the checkpoints with the doctors during that chemo treatment time?
So I was coming every 2 weeks for the chemotherapy. I can't remember if I had like additional uh, appointments during that time because usually you come the day of chemo and you have all the checkup with your oncologist before going to treatment. They check your blood test because depending of the levels, you may or may not be able to have your session that day. Because if your white cells are too low, they cannot do the session. So it happens to me once because I had a fever, like a herpes on my lips.
Oh.
Because you get side effects, and a small thing for normal people would be nothing. But if you are like in treatments, I had to go to emergency. And my levels were too low so that day, so we had to push it back a few days. So you don't want it to happen because it pushed back all your treatment. So I was lucky it was only a few days. So you have those checkup like every week, every 2 weeks with your
And
oncologist.
and so after you had the chemo, what happened after that? What were some of the decisions then?
Yeah, so after that, so it was the surgery was planned. So in between, we got like the genetic testing. So we knew that there was like that connection with the breast cancer. And we also knew that the size of the tumor was pretty like big. I think it was 3 centimeter. And I also had like some lymph nodes under my arms that we knew at least that one was cancerous. So the decision to go to a mastectomy was kind of done at that time. So it was, we forgot about lumpectomy, it was mastectomy. And since I had like the gene, I push to get the double mastectomy. So I didn't want like to take the chance of recurrence on the other side. So we decided to go with a double mastectomy.
Mhm. Did you have reconstruction as well?
Yeah, I got the reconstruction at the same time. So they
Ah,
did the double mastectomy and put like some expanders. So it's not like the final implant. It's like expanders that they will after the surgery each week they will build them, like they will increase like the size. So your skin has time to get used to it. So until it reached like
mm,
the final, and also I had to keep them for until I was done with the treatment because I had radiation, so radiotherapy
oh.
after. So I got the exchange to the final implants only a year, about like a year after the mastectomy.
Yeah, it takes a while. In fact, I have a girlfriend who just last week had her reconstruction after she had the expanders.
Mhm.
Uh, in for a while, and her too. She had her mammogram, and then 5 months later, she was diagnosed with inflammatory
Mm.
breast cancer, and she had a double mastectomy, and I'm mad at her because she didn't tell me anything about it until after everything was all
Mm.
done. Her chemo was done, everything was complete, but a lot like you wanted to explain to your colleagues your
Mm.
diagnosis and the way you did through an email, and so it seemed very it's very personal. So
Mm.
how you choose to talk about it with friends and family or colleagues is certainly really up to you, and what makes you most comfortable.
Yeah, and I think it is changing. Like there were a big stigma around cancer that people were not talking that much, like at least 9 years ago. I feel now maybe it's because I'm following more people in that field, more influencers in, but you were not talking too much about your diagnosis. There is kind of almost a shame why you
Hmm.
didn't. And also, yeah, there's also some reaction that I got, like when sharing some time with people. This is a lot of fear. People are afraid for themselves, like they fear, like, oh, maybe I will get something similar. So at some point there, I don't know if I want to share with more people because I prefer to have like my close friends. And my colleague was a bit different, is that they will have known anyway at some point because I continue working during that time, and I will need their help for the flexibility because I was going to chemotherapy every 2 weeks. So I needed like support to cover for me. So I wanted them to understand what I was going through. So that's why I decided to tell everyone like pretty early.
Sure, and so many women unfortunately don't get that kind of flexibility, or they're in jobs where they're maybe part-time or don't have insurance, or they have families and the only income is this, say, part-time job maybe. So certainly, I think we all acknowledge when we're in a fortunate situation where we don't have to deal with that. But unfortunately, there's a lot of women that do need to deal with that and may not always get the care that they need.
Yeah. Yeah, no, it's a big problem. And coming from Europe, where in France, like people were thinking that they didn't understand like why I was like still working, because
Mm.
in will stop like as soon as your treatment starts. Like you will be on long term disability and fully covered, paid for a year if it has to last a year. Like why here you have some disability, but it's not. You have to play with it because you don't have like an extended time, and it's not fully covered the same way. So yeah, so it was a big surprise, like for my friends in Europe, to know that I was still working. But for me, there was also a decision that I never really considered stop working because I wanted to have my mind like thinking of something else to keep
Mhm.
working, to keep seeing like friends, to and not just be focused on treatment for some amount of time.
Yeah, anything to feel normal, right?
Yeah, exactly.
Yeah,
Mm.
yeah, and have some distractions also. How do you it's interesting that you brought up uh what the European approach might be to breast cancer treatment. How do you think your journey would have been different had you been diagnosed in Europe?
So there are like goods and bad things. Like so, yes, for sure, I would not have to worry about being covered, like the cost of like health, about working, not working. That part is very good. The drawbacks of that system is that that it's more public and covered is the wait for health diagnosis. Like here, I'm in New York City, so it's very different. But I was seeing like my doctor the morning, the afternoon, or even like in the hospital at Memorial Sloan Kettering. In the minute after, she was sending me to another floor, and I was getting like any test I needed. And there was no wait. I was going from one to the other. So I know that's very specific of New York City and that hospital and my health insurance. But in that sense, like I was almost like I felt like I was luckier to be here than being like in France, because I know like I have like family and friends who had like to wait for a month to get a genetic testing or to see an oncologist. And I never had like that issue here because it's private. But the good thing of that, like if you have a good insurance, is that it goes a bit faster.
Mm. Interesting. Yeah, definitely pros and cons
Mhm.
between both systems. So at this point, Severine, you've gone through your chemo, you had surgery, you had radiation, you had reconstruction. And I thought it was interesting that the doctors, if I got it right, were kind of looking at you as this very like the unicorn of triple negative breast cancer that, like we said, you didn't have any indicators, history, nothing like that. And so what would you say the team learned from you as this unique patient?
I think we won't know until a few years because everything is for like every research like is more like a 10 years generally until you see like results because we
Mm.
need to see on the long term. I'm part of so many research that I forgot. Like I get so first I was part of a clinical trial.
Okay.
Uh, as I was telling you, like there is nothing once you're done with treatment to avoid recurrence. So the tamoxifen is not something that applies to triple negative breast cancer. But I was offered to be part of a clinical trial after the end of radiation of radiotherapy. And I took like some medicine for during 2 years. It was a treatment that is normally used for prostate cancer. So it was a phase 2 of a clinical trial. So we knew it was possibly working. So it's not like kind of the first phase where you don't really know what's happening. So there was some encouraging results. So I was in that phase 2. But I think we don't know yet, like what are the impact because it's probably something we'll need to wait like 5 to 10 more years until to see the impact. I was also part of different like research since I was athletics and sport, doing a lot of sports. I did some research with the radiotherapy team.
Mm.
They wanted to understand the impact of radiation on exercising. So we did prior to start radiotherapy, like some exercise tests, as you can see for very like a professional athletes that will go on a treadmill and with measuring like your all your breathing, your heart rate, and so I did that before and after radiation
Mm.
because they were using a different type of radiation. I think it's called curved. So instead of going directly on your heart, it it kind of saves like your organ that are under and just follow kind of the shape of your breast. So we did that. I'm also on some other research program for lymphedema because I have we cannot see here, but
Oh.
I have like a, a condition that's related to radiation. So you have like, I think, 15 to 20% chance to get what's called lymphedema. Is that it's not radiation? I messed up. It's
Mhm.
that because during the double mastectomy, they removed all my lymph nodes because they discovered during the surgery that at least three lymph nodes had cancer. We removed almost all like the main like chain of lymph nodes. Um, thing is that the liquid that used those lymph nodes to go through my arm, it doesn't work that well because they are not so there's not like the path anymore. So
Mhm.
it's a bit like more difficult to have like a good flow. So we have like 15 to 20% chance to get lymphedema. And lymphedema is that your arm is swelling. So that right arm is 17%, I think 18% bigger than my left.
Oh.
And we manage it like it's a pretty mild condition at high stage. Like it's not like huge, but sometimes you can see, and it can be on different parts, like for breast cancer, it's on the arm, but it could be something in the legs for other type of cancer. Um, so since I had this condition, like I'm also part of a research, so we measure like every year, we do some survey to see how it impacts my life, like the type of treatment I can do to manage the swelling. So yeah, that's another, and I think I'm another research that I forget, but they make me come and test me out. Yeah, let's do it.
Wow, that's incredible that you're part of all of those studies. How did you learn about all of those?
So generally they offer you like to be part of, and since I was a researcher, like I was interested, like it's my way to give back, and also curious about the results, about like the type of sample they're looking at, the type of people, and the way they measure it. So it was a mix of curiosity and giving back
Yeah.
to science if it can help people with triple negative breast cancer here.
Yeah. And you had said what we had talked about was with triple negative, there isn't a targeted therapy for it. So how would you describe the type of chemo that you did have?
Yeah, so it's, oh, I don't know if it's the right term, but they kind of use like the generic like chemotherapy and the strong one, which is like infuse it in your body and hope that it will kill all the cancer cells. Why I think, and if it's hormonal, there's like ways to better adapt like your chemo treatment to exactly what you have. And why for triple negative, like we take like the strongest, and we just uh, do like that protocol.
Mm-hmm. Yeah. Um, so you talked about giving back through all of these, being a participant in all of this research. Um, for you, what would you say, if anything, are the silver linings that may have come from your journey?
Mm. Um, I think the first learning is really to pay attention to your body and be really like observe it, like be listening to your body, and making sure like you are making all this key checkup, like your annual checkup, like it's important, like to get your blood test regularly, to go to your OBGYN like every year, to go to do your mammogram. Also, like keep in mind that it's not because you're young, healthy,
Mm.
that you are like yeah, you may not like have like health issues. So very like yeah, being aware of that. Mm. And I think another like silver lining is really that you learn like that what's important, like how you manage like stress, and what's important, what is less important. Um, yeah, to prioritize what's important in your life, and that your family, your health is more important than maybe giving like that report at the deadline, or that
Mm.
yeah, like ways like to handle things, that and prioritizing your what's important for you.
Yeah, yeah. So definitely some silver linings there. And how would you advise a woman to advocate for herself? We talk so much about advocating for ourselves, and that means different things to different people. But what did it mean for you, and what kind of advice would you give a newly diagnosed woman?
Um, yeah. So, and I think now, like that's really like changed, like probably also because of a digital era we are into. But there are like so many support groups. So that's a good way, like also like to understand what are your options, because, and I feel like, and I've seen this because I have some family members and friends that are going through like cancer experience, and that kind of just follow the path, like what the doctor will say. But you can be your own advocate. And yeah, if you don't agree with a decision, maybe ask why the reason to go that path. What are my other options? And I did that. Like there are some options I didn't agree on. I didn't want like to do some specific surgery for another. Like so, and ask like what are my options, and so I can make my decision, the pros and cons. You can get the second advice. Like there is no problem with that. Like, I think also like the medical teams are open to that, most of them. So yeah, take your take your decision and do your research, kind of.
Definitely. Yeah. You definitely need to make sure that you're comfortable with what the doctors are telling you or suggesting for you, and explore if there are other options or not. But considering where you were going, you were probably getting very good advice. But did you go for a second opinion?
So I was lucky is that my mother-in-law worked in cancer research all her life in France. And so she was able to get second opinion for me from a team like in France. So that's the way, like, I was lucky in that sense that there was always someone that could review what the protocol was and what my options were.
Very lucky. So mother-in-law was working in cancer research. See, it was meant to be that you picked the husband that you picked, who has a mother-in-law who works in cancer research, and who knew that would come in handy at any point.
Yeah.
That's amazing. That's amazing. So as we wrap up here, Severine, how would you say your diagnosis has impacted you the most, whether it be in positive way or not so positive way?
I think, yeah, so it changed, as I was saying, like the way I see life. I've been also uh, very resilient. So I saw that like in the way I managed with it. And I think it's been helpful, like in everything I've done after, like in my professional, personal life. To take an example, I ran the marathon 3 times after being like treated with cancer.
Oh
And
my
the
gosh, that's
resilience you have like
amazing.
for
Oh,
treatment was useful for like running a marathon. So you learn to, yeah, to be comfortable being uncomfortable. So I've learned that. Yeah.
that's amazing. I can't even run like a block, being, relatively healthy, let alone running a half marathon after cancer treatment. You are an amazing lady, no doubt. And resilient doesn't even describe it. That's incredible that you did that. Um, Anything else, Severine, that you would like our audience to keep in mind, or any words of wisdom that you'd like to leave them with?
Yeah. So, and something we were saying about like telling others, like sharing like your story. This is something I've started to do much later. Like it took me, uh, sorry, it took me probably like 5, 6 years, like after like the end of treatment, to share my story. And I think it's important because it helps like other women in the same situation to understand. It also helps like the stigma around cancer, that it's not a death sentence, that yes, you can work during cancer treatments. Yes, there are plenty of things that you can do. I think that's important, like now, like for me, like to share my story.
Yeah. Was there one thing in particular that did help you cope through the diagnosis and the treatment?
Exercise.
Mm.
And something that we didn't mention, I think that's important, is that um, for me, I would say like, so treatment was difficult, really chemo, but it's also the after treatment that is really a tough phase to go through. So when you are done with treatment, you are sent home, say, okay, there's no more cancer. Thank you. Come back in. So at the beginning, you come maybe 3 months, 6 months, 1 year, and there's that feeling. And I know like a lot of like cancer survivor go through it, is that you are left alone. You,
Oh,
you like get like some anxiety, and it's for the mental health, like it's very difficult. And I don't know if we talk enough about this, that it's not just about like just the physical health, like the getting rid of cancer. It's also after, like how you deal, you cope with the situation of being a survivor and living with that threat of maybe cancer will come back. So I think that's important also to talk about like the after cancer phase.
yeah. Yeah, I'm not kidding. I just read something about that. I think this morning. It might have been on LinkedIn, I'm not sure. But I just read something about that, where cancer patients have this craziness of appointments and tests and then the treatment and for all these months out, and then all of a sudden it just stops. And it's almost a shift in lifestyle too. You ran your whole schedule around treatments and appointments and all of that, and then all of a sudden it stops. And from what I read in the article, patients just kind of stop and say, well, now what? And you are in this active mode of treatment and feeling like patients feeling like I'm doing something and I'm going to be cured, or at least I'm trying to. I'm being very proactive, and then that all stops, and then this, like you said, this anxiety kind of sets in, and some patients wonder, is it going to come back because now I'm not doing all these things, and now I need to figure out how to live my life in a way that's kind of the new normal, but sort of normal, like how I was before, but how do I do that? Did you go through all those things?
Yeah, no, definitely. Like I went through that, and I don't think we are prepared for it. And also, like the answer is, it tends to be like very medical. Oh, yeah, we'll help you like with medicine for your stress, for your anxiety, and that's where, like for me, like exercise really helped. Like, and I started like running much more, like and building community around that, and it may not be the option, the solution for everyone. Like you may need that support of like medical, more like treatment for your mental health. But yeah, I just something that surprised me, and that it's not mentioned that much when you go through that experience.
Yeah. So the after treatment
Hmm.
phase, which hopefully will last a lifetime, right? So that you don't
Yeah.
have to go back into treatment. But how do you kind of get back to life, and how do you, probably in a lot of ways, how do you prevent it from, always being in the back of your mind, wondering, is it going to come back, and are you still going for scans and things on a
Yeah.
regular
So
basis?
now I'm on the survivorship program, as they call. So it's
Mhm.
only once a year, for the full like checkup. I have like a few like more appointment during the year, also because I'm part of all these studies more than really for me. Uh,
Mhm.
I think as the years like go through, it starts like to like it's bit less stressful. Like during my last like checkup earlier this year, the my PA, like the physical assistant, I saw like mention, "Oh, you are almost at 10 years." And I was like, "Oh yes, that's true.
Oh,
Next year technically will be 10 years since diagnosis." So, yeah, I feel less stressed. Like, and for triple negative after 3 year, it was already like a big, like an important deadline for me, like to
mhm.
be cancer free for 3 years, 5 years, even more. And after 5 years, like it starts to be less in your mind all the time.
Yeah. Yeah, that's a long time though to have to kind of get comfortable with the idea that,
Yeah.
well, maybe my treatment really worked and maybe it'll work long term, and and I'm good. But this idea of survivorship, what do you think about that term, and what does it mean to you?
Yeah, this is funny because I'm not even sure if it exists in French. It was something I was thinking, like if we have that word. Um, Yeah, yeah, I don't know. Like I think I live with it. I don't know if yeah, I don't have like a strong opinion about this. Like it feels like a bit even stronger than what I feel like to be a survivor. Like I didn't escape like a fire or something. But yeah, it's true. It's a big like event in your life. But I don't know if survivor is the good term. If it will be something else, but that would be better.
Well, as they say, you're surviving, but more so thriving, to
Mhm.
be a little cliche here, which is,
Yeah.
it sounds like you're doing more than that, Severine. I want to thank you so much for being so open and telling your story. And I do hope that it does help other women, young especially, experiencing this type of diagnosis, but really all women who deal with breast cancer treatment. And certainly there's all kinds of different breast cancers as well, and they come with all different nuances of treatment, etc. But I want to thank you for telling your story and being with me today.
Thank you. Thank you for having me.
My pleasure. My pleasure. Well, thanks everyone. Thanks for listening to another episode of the Desperate for a Diagnosis podcast. I'm Laura Nozica. I wish all of you well and keep on pushing for answers.
Oh my goodness, that's a wrap on another compelling story. Thanks for listening to the Desperate for a Diagnosis podcast. If you would like more information about today's guests or to find out more about Laura, me, go to desperateforadiagnosis.com. If you enjoyed the show, please subscribe, rate, and review the podcast on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. You can also follow show updates and healthcare news on the podcast's Facebook page. If you would like to be a guest on the show, or if you have any questions, advice, or suggestions for our guests, please email me at lauramarie@desperateforadiagnosis.com.